Thanks for joining us today. Welcome to the Center for State's video series on implementation planning and capacity building. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. The Implementation Planning and Capacity Building Brief is intended to help child welfare agency leaders, managers, and stakeholders take a structured approach to planning the implementation of an activity, program, or intervention to address a problem or need, and consider strategies to building agency capacity to implement it. It does this by providing step-by-step guidance to prepare for implementation, make a plan for addressing any gaps or capitalizing on strengths, and then develop a plan for implementation that includes the actions needed to get ready, actions needed to implement, and actions to measure implementation progress. Implementation planning and capacity building is broken down into 3 parts and 8 essential functions or steps that may be presented linearly, but they often overlap and teams will loop back and forth between them. At this point, teams should have outlined the elements to include in their plan, identified the sources to pull the information from, and considered the context, then revisited their teaming and leadership structure, reviewed readiness assessment findings, developed strategies to build capacity and strengthen motivation for implementation, and identified work plan activities to get the intervention ready to implement. In this module, we will look specifically at building the work plan activities around getting the agency ready before implementation. Activities to get the intervention ready is addressed by Module 7 in this series. Before we move on to identifying work plan activities to roll out and measure the intervention, to communicate and engage stakeholders, and then consolidating the plan as needed. Let's get started. Why do agencies identify activities in the work plan that are specific to getting the agency ready? It is just as important to plan for the agency to be prepared for a change effort as to ensure that the intervention or change effort has everything it needs to be implemented successfully. If the intervention is ready for implementation and the agency is not, the implementation efforts may be delayed or put on hold until critical supports are in place. Planning these activities creates the structures and conditions needed to support successful implementation. For example, revising hiring, training, or coaching structures and protocols needed for the new intervention or program, and updating data collection and reporting systems and protocols to collect the data needed to monitor the new intervention or program. And planning these types of agency-centered activities helps to strengthen the supports that allow the intervention to be implemented as it's intended. A framework or structure that is carried throughout the work plan will help consistently and clearly identify key information about each key activity or task. For each key task or activity that will prepare the agency to get ready, teams should document the projected timeframes. So how long will the task or activity take? Is there any urgency to complete it before moving on? Notes on necessary preconditions, interdependencies between tasks, and sequencing. What order do the tasks need to be completed in? Are some dependent on others being done first? Milestones. What products or indicators will signal completion of the task? And responsibility. What individuals or groups will be responsible for completing the task or activities? Developing or strengthening needed implementation supports and structures within the agency is important to implementation success. Teams can reflect on their readiness assessment findings and capacity building strategies work to identify action steps that will develop or strengthen areas needed. The National Implementation Research Network outlines key supports or drivers that are associated with successful implementation efforts, and 2 critical areas that support getting the agency ready are the ability of workforce to carry out the intervention and creating the agency conditions needed to support implementation. Examples of supports that focus on workforce ability to carry out the intervention include recruitment and selection of staff to manage and deliver the intervention, training for staff and supervisors, coaching for staff to practice and apply skills, and assessment protocols to monitor whether implementation is happening as intended and support adjustments when needed. Examples of supports that focus on creating the conditions or environment needed include policies and procedures to guide the intervention and new ways of doing work, data collection and reporting systems to monitor implementation and inform decision making, and communication processes to engage system partners, stakeholders, and families. Let's consider some actions or tasks that might result from two of these example supports. Taking the example of recruitment and selection of staff to manage and deliver the intervention, let's think about what might be some critical action steps or tasks that could be in a work plan. Ensure job descriptions are clear about expectations and accountability. Develop processes to recruit in rural areas or recruitment strategies that ensure the key needs of the target population are addressed, for example, language needs. Establishing interactive interviews or hiring committees and processes for scaling up hiring as a rollout is staged. Now let's look at the example of data collection and reporting systems to monitor implementation and inform decision making. What might be some of the critical action steps or tasks that might go into a work plan? Some possible examples include aligning data with intermediate and long-term desired outcomes and process for documenting in current system, including performance or fidelity assessment results for each practitioner, and ensuring data are reliable, reported regularly, built into practice routines, and used to make decisions. Another key area to plan for getting the agency ready is developing capacity and building motivation for a new intervention. Teams may have already considered strategies to prioritize and build agency capacity, explained in Module 5 in this series. Now is the time to identify what actions the agency needs to take now and in future stages that will continue to build capacity for a successful implementation. Capacity building activities might support securing resources to support implementation, building relevant knowledge and skills, or developing infrastructure and administrative supports. Teams will also want to identify activities that will build motivation and buy-in for implementing the new intervention or program. These activities might support cultivating a culture and climate that supports implementation, strengthening engagement and partnerships, and building buy-in and motivation for the intervention among leadership, staff, partner agencies, and the community, which includes youth and families involved in the system. Let's consider some actions or tasks that might result from two of these example supports. Taking the example of relevant knowledge and skills for the intervention, let's think about what might be some critical action steps or tasks that could be in a work plan. Adopting a train-the-trainer model with intervention purveyors. Outlining timeline and milestones for training trainers, training staff, and coaching or supervision needed at each level. Now let's look at the example of building buy-in and motivation among community members. What might be some critical action steps or tasks that might go into a work plan? Possible examples include conducting focus groups with families and youth with varied perspectives, including birth parents, foster parents, and relative caregivers, to share information about the planned intervention and gather feedback on cultural or other considerations that should be made to ensure effective implementation. Communicating how the intervention complements the agency and sharing early successes, and sharing why the selected intervention is better than current or alternative practices. Let's take a look at what can help teams identify work plan activities that get the agency ready for implementation. Teams should consider the following as a group to ensure that the activities and tasks that prepare the agency for implementation are comprehensive, prioritized, and support the buy-in and motivation of staff, stakeholder groups, and families. Teams should think critically about the timeframes, preconditions or sequencing, milestones, and roles and responsibilities for each task and outline them clearly. They should discuss what cultural and contextual issues should be considered and what activities or tasks might be needed. And consider how system partners, target population members, and other key stakeholders will be involved in planning. Let's check in on an example of identifying work plan activities that was outlined in the brief. Before completing a new family search and engagement program, the Washoe County, Nevada Department of Social Services identified several activities that needed to occur. Based on its organizational readiness needs, the agency's implementation team planned activities related to administrative and organizational support, so identifying new roles and responsibilities for caseworkers in the public agency and their community-based services partner agency. In staffing, it was focusing on the recruitment of existing staff to implement the new program, a strategy guided by assessment findings that showed some staff possessed the needed values, skills, and commitment to perform the permanency intervention. Training and coaching was contracting for caseworker training, assistance with adapting a coaching protocol, and case consultation for agency supervisors. For fidelity assessments, it included working in partnership with the program developer to develop a set of fidelity assessment measures and protocols. For data systems and collection, it included establishing a process for accessing and evaluating case data related to the intervention outputs and outcomes. In service array, it was addressing a lack of support services for families by confirming the availability of existing services, extending service provider contracts, and developing protocols for coordinated referrals and service collaboration. These activities supported the county's ongoing readiness for its new initiative and outlined clearly what steps they needed to take to ensure that implementation of the effort was a success. Let's take a moment to check in on what you've learned about identifying work plan activities that get the agency ready for implementation. Why do teams identify work plan activities that get the agency ready? To create structures and strengthen the agency supports that will help implement the intervention as intended. How do teams identify work plan activities that get the agency ready? Develop a framework. Consider activities that develop or strengthen key supports from readiness findings, and activities that build capacity and motivation to implement. What can help teams identify work plan activities that get the agency ready? By using a framework with clear and consistent structure, discussing any cultural and contextual considerations, and considering how system partners, target population members, and other key stakeholders will be involved. Now take this a step further by reviewing the reflection questions for identify work plan activities that get the agency ready in your implementation planning and capacity building workbook to connect what you've learned to your own experience. Up next is build a work plan. Identify activities to roll out the intervention and measure implementation quality, the 9th module in this series and the 6th function in implementation planning and capacity building.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P2332014000033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.